Hi, I'm Dr. Akila and I'm a consultant obstetrician, gynecologist and a fertility specialist practicing at Fertilite IVF Clinics, BTM Layout, Bangalore. So today in this video, I'll be talking about causes of infertility in women. So infertility is defined as unable to conceive after 1 year of regular and unprotected intercourse. 85% of the couples conceive by end of 1 year, whereas 15% of couples face problem in conceiving. That is where we say incidence of infertility is 15%. And what is the contribution in females and males? Female contributes for 40% and the rest of the 40% is contributed by men, and the combination of both is seen in 10%, and the rest of the 10% we may not find the cause at all, so which we label this as unexplained infertility. When I talk about the causes of infertility in women, first you need to understand how female reproductive organ looks like. So these are the ovaries, these are the tubes, this is the uterus, this is the uterine mouth that we call as cervix, and this is vagina. So when I talk about the causes of the infertility in women, so the causes might be at each level. So when I talk about the ovary, so ovarian causes, so it will be divided as ovarian causes, tubal causes, uterine causes, cervical causes and vaginal causes. So when I talk about ovary, the most common cause of infertility in women is polycystic ovarian syndrome. Polycystic ovarian syndrome, and also if diminished ovarian reserve, where ovarian reserve is very less. And the third one is endometriosis. Endometriosis is a condition where there will be retrograde menstruation. The menstrual blood will travel back along the tubes and will get deposited in the ovary. So this is a condition we say as endometriosis. And so these are the major things, 3 things that we look for. And also the fourth one is premature ovarian insufficiency. So premature ovarian insufficiency is a condition where she has stopped her periods before it could reach menopause. So these are about ovarian causes. And the next thing is tubal causes. So tubal causes, either the infertility may be due to the tubal damage, fallopian tube damage, or tubal block. Fallopian tube damage can occur either because of infection or because of pelvic inflammatory diseases or because of sexually transmitted diseases due to chlamydia or gonococcal infection. So all these things should be taken into consideration. And if she would have had a previous history of ectopic pregnancy where she was operated for that, where salpingectomy was done, so in that condition again we may see tubal block, so that also should be taken into the consideration. These are about the tubes. When I talk about the uterus, again we look for space occupying lesions. So mainly space occupying lesions should be taken into consideration. So these are the acquired causes like fibroid uterus or polyps or any adhesions in the uterus, and that we call it as Asherman syndrome, or any kind of adenomyosis. So adenomyosis is a condition where the menstrual blood will travel along the muscle fibers of the uterus, and we label this as adenomyosis. And there may be congenital causes also, like septate uterus. Maybe there may be some septum in the uterine cavity. There may be septate uterus and abnormal uterine shape like bicornuate uterus, unicornuate uterus. So all these things also should be taken into consideration. When I talk about cervical causes, it may be due to infection or any kind of polyp in the cervix, and if any kind of tumor or fibroid in the cervix, and that also will affect our fertility. And even anti-sperm antibodies also will affect the fertility of a woman. And even the cervical stenosis, that is also very important to take into consideration. And regarding the vaginal causes, again vaginal infection and vaginal cyst and even vaginismus. So these are the 3 main important things that should be taken into consideration. And there are other general causes which are also important. One is stress, obesity, and even inadequate food intake, mainly the diet of the women. All these things also should be taken into consideration, and even any kind of hormonal imbalance, either maybe due to thyroid or prolactin. So these all things also should be evaluated, because this also will affect our fertility. So in the next video, I'll be talking about causes of infertility in men. So I think for the causes of infertility in men, you can visit in the next video. Thank you.